right now, India's COVID-19 situation is under control, with health authorities closely monitoring the surge in the cases in Hong Kong and Singapore as well. Recent media reports highlight an increase in cases in these countries over the past few weeks, but preliminary information suggests that the cases are mostly mild, with no unusual severity or mortality reported.
We've been joined by Delhi's top-known and most loved pediatrician, Dr. Nitin Verma. Dr. Nitin Verma, thank you very much for speaking to Republic. The COVID cases are on the rise, and it's a cause of concern not just among the youth, the elderly, but also now to children. You're a pediatrician, and I wanted to know from you, Dr. Nitin, what is it? What are the early symptoms that we see in a child when the child is first detected with COVID, especially with the new variant that we have just discovered?
Okay, so let's understand one thing to start with. COVID is here to stay. It's endemic. And periodically we'll keep getting cases. The cases that we are getting now are the LF7 and the NB1.8. These are strains of the JN1 Omicron variant which are there.
Right.
Most of the cases that we are getting are very, very mild. And I've seen 2 children in the last 7 days who tested positive. Unfortunately, both of them picked up from grandparents who traveled from abroad.
Right.
So they were not local cases.
Right.
So sore throat, fever, little bit of cough, fatigue, sometimes a little bit of cold. So symptoms indistinguishable from normal flu. What we need to know is that we need to have a high index of suspicion. So we should always keep COVID in our mind when we are dealing with viral cases.
Right. So, doctor, when a child detects the COVID in the first stage as well, during the initial days, do you recommend the child and their parents to first treat the initial symptoms like that of fever and fatigue with a normal medicine like we eat in everyday life, like a dolo, or do you recommend them to go to the doctor first and then take the necessary steps that the doctor's advice?
So, actually, the one good thing is that most children have a regular pediatrician. So certainly consult your doctor on the phone. I think there is no need to rush. There is no need to, run to a hospital. Treatment is symptomatic. Just manage the fever and fatigue with paracetamol, as you said. Take lots of fluids, take a high protein diet, and stay in touch with the doctor. If you find that there is any worsening of symptoms, then certainly take the child and have the child examined.
Absolutely. Doctor, what would your last word of advice be to every parent that is watching this show right now? Because it's become extremely worrisome, the situation right now. Everybody is saying that the COVID is back, the surge is back. So what would your initial advice be to all those viewers of Republic TV who are watching this show?
So 2-3 quick things to remember. This is a virus, and we got immunity either through a vaccine or through getting COVID. As a period of time extends, the immunity tends to wane, though the body has immunity. That's point number 1. Point number 2, holiday season. Everybody is traveling. The world is one place. Schools are going to shut. Everybody is traveling. All I'm telling people is do not panic. It's a normal virus. Lead your life. Be cautious when you go to crowded places or you go to medical facilities. Mask up, wash your hands, try and keep your distance, live life normally.
Right. Thank you very much, Dr. Nitin Verma. It was lovely speaking to you. A very insightful session indeed. I'm sure it's going to help all our viewers and every parent who's watching this right now. Thank you very much for speaking to Republic.
Thank you so much.